Our featured speaker is a physician who is CEO of the Practice Clinics of America, one of the top 3 direct payment practices in the country. His vision is to change the paradigm of medicine for thousands of private primary care doctors and millions of patients in this country. He has done both family medicine and neurosurgery residencies. He created one of the top 3 direct payment care practices in the nation, in the second sickest, second poorest counties in the state of California. He is selling franchises of this practice across the country and started up his own insurance company for his franchisees. Before the franchisee opens his doors, they send in an insurance agent to sell to businesses and individuals so the franchisee can start with positive cash flow. That is progressive. Please welcome Dr. Jan Mensink.
Wanted this afternoon thank the Harvard Business School and the Wharton School here for allowing me to come and talk to you. I have a dream, and this dream is actually, I'm embarrassed to tell you, was started 19 years ago. After my first residency in family practice, I went to practice and I got on this treadmill and I was bored and sick because I was on this hamster wheel and I couldn't get anywhere. I didn't have time to spend with my patients. My patients didn't get better. You could only make money if I put them through faster or played the coding game. I finally quit in disgust. I did neurosurgery residency and I practiced neurosurgery for years. I was very blessed and fortunate with that. But finally, I got ready to turn 59. And I'm sorry to tell you this, but it took me till 59, 6 years ago, to decide to do my dream. And that was to start the practice, or the Practice Clinics of America. What happened over that is to change the face of medicine for our area. Let me tell you 3 stories. Story number 1, I have a patient who's with me for years, one of my first patients. He's on tier 1, he pays $79 a month. And he comes at work and he takes a 5-inch laceration on his forearm. It's early in the morning, the boss is really angry, fires up the pickup, is going to bring him to the clinic. Make a long story short, they had an argument on the way. My patient said, listen, I'm going to see Dr. Mensink at the practice. He's going to sew me up. And the boss says, you don't have an appointment. They don't do that anymore. You can't just walk in. I mean, the truth of the matter is I see 5 patients every morning instead of 20. We do more than most urgent cares. We look after 92% of everybody's health care in the practice. Make a long story short, he comes in, we sew him up. 45 minutes later, the boss is at the checkout window, and he pulls out his checkbook, and the girl gives him a bill for $40. He calls me over, and he says, Dr. Mensink, I'm not stupid. I'm in business. He says, 2 weeks ago, I had another employee, a 3-inch laceration, took him to urgent care. It cost me $1,200. He says, how do you stay in business? You see, the boss doesn't understand. My patient paid me $79 every month for my time. I don't charge him for sewing them up. I charged them $40 for the suture and the tray fee. See, that's the power of the practice. Our goal in the practice is cost-effective quality care in a concierge environment for the common man. Everything we do is to make it a better product for our patients. I have a patient, his name is Dan, and he needs an MRI of his knee. He has insurance, pretty poor insurance, by the way. Anyhow, he needs an MRI, and I told him, Dan, you're not going to use don't even give me your insurance card. You're going to use our practice discount. He doesn't listen to me, and he gets his MRI. 2 weeks later, he gets a bill for his copay for $700. What's worse, we have to redo it 6 weeks. I'm not going to spend another $700. I said, Dan, you didn't listen to me. You see, here's the thing. He went to our place to get his MRI, and you know what it cost him? $137. You see, that's the power of the practice. That's the power of helping people make medicine more cost-effective quality in a concierge environment for the common man. You know, we do a lot of testosterone pellets in our office, a lot of bioidentical hormones, and it's amazing what happens. And in our town, they charge $800, $1,500 for pellets. We charge $200 for the cost of the pellets. We're negotiating to get the pellets down to $125. That doesn't mean I make $75 more. What it means is I can offer more value to more patients, give them a better service so more people join. 3 weeks ago, I was in Kevin McCarthy's office, and I spent about half an hour, and he listened intently to what I had to say. And this is what I told him. Today in this country, if we offered a direct payment care practice for every man, woman, and child in this country, it would cost us to cover 92% of all our patients' health care $350 billion. That's 1/10 of the $33.5 trillion that we spend today, with only the 7th best health care in the world. I have this goal, and I want on my tombstone, when I die 35 years from now, I wanted to say this. This doctor changed the paradigm for primary care in this country. He had changed the doctor's perspective for medicine, helped thousands of doctors and millions of patients to a different lifestyle. And I thank you for my time.
Dr. Mensink, yeah! Great job.